Welcome back to Adaptive Humans, the podcast for real talk and intentional growth. I'm your host, Jami de Lou. Around here, we come back to three anchors each week: emotional intelligence, cultural intelligence, and nervous system regulation, because they help us stay human when life gets real. A quick content note about today's episode. We'll speak honestly about birth experiences and maternal health inequities. If that's a tender topic for you today, please take good care. Pause, maybe skip, or come back to the episode when you're ready. Today, we're talking about birth and the kind of care that centers dignity. Even if you're not a birthing person, this conversation really matters because what we understand about maternal health shapes how we show up for friends, family, coworkers, and our communities. In the US, Black mothers face disproportionately higher risks during pregnancy and postpartum. Awareness isn't about blame. It's about better support, better questions, and better care for the people we love. My guest today is Leah Hairston, founder of Sweet Bee Services, a full-spectrum doula collective. If the word doula is new, think of a trained support person who walks with you before, during, and after birth, emotionally, physically, and as a guide through the medical system, which could sometimes feel tricky. I invited Leah here because her work blends advocacy and tenderness. A little bit more about Leah is she's a seasoned doula with a mission to end maternal mortality. She's a founder and CEO of Sweet Bee Services, which is a full-spectrum reproductive health agency based in Baltimore, Maryland. Leah and her team are committed to empowering women and addressing systemic reproductive injustices. They provide justice-focused, trauma-informed, and family-centered care. Leah also serves as an instructor and mentor for the National Black Doula Association. She's a graduate of Howard University and Columbia University. Leah enjoys exploring new recipes, diving into audiobooks, and taking walks with her pup, T'Challa, and cherishing moments with loved ones. I am so excited for you to see and hear this episode today. You are in for a treat with our discussion with Leah. Let's get started. Leah, welcome to Adaptive Humans. I'm so glad you're here.
Thank you, Jamie. It is an honor to be here.
Well, I'd love to dig in. We start with the first segment, Beyond the Bio. And this segment is
Mhm.
really where we meet the human behind the title and the description that I've just covered before we started this conversation. I want to think back when you think about what you're doing as a doula and as a leader and a founder of an organization, before all the credentials that you've earned, what early
Mhm.
experiences or mentors shaped the way you show up for birthing people? Was there a moment in childhood, your community, or training, or what was it for you that lit the fuse to do what you're doing now?
I smiled as you asked the question because my earliest memories are of caregiving and are of my mom taking care of my younger siblings. I'm the oldest of four children, and so I always tell our clients and team members whenever people ask, like, how did you get started? I was like, well, I was the oldest sister. And so I had a Cabbage Patch doll named Sonia that I would take care of while my mom was breastfeeding my siblings, or I would pretend to change a diaper, or I would learn how to burp. I learned how to put baby clothes on with baby Sonia. And so there's something innately inside of me that enjoyed that process of helping to care for a new baby. But I also began questioning at a very young age who takes care of the mom, who takes care of the
Mm,
person that is taking care of this baby. And my parents fondly let me know that my first books were actually my mom's biology books from college. And so I would open up her textbooks and I always found the picture of a person giving birth. And I was like, so what happens here? And what's that body part? And like, what is this process? Because my siblings and I were all born within 5 years of each other. So I remember distinctly, like, my parents got pregnant, they went to the hospital, they came back with a baby, they kept doing this. I was like, why? What is going on that you all do this repeatedly? And so it sparked this question for me. And as I grew older, my mom and the women in my community shared more about their experiences and how they weren't always supported, they weren't always like safe. And so I really dove deeper into what would it mean and what would it look like to support people who are giving birth in ways that help them to feel safe and to feel honored and dignified. And when I learned about doulas, I was like, well, here's an opportunity right here. But I
Right.
never saw Black doulas. I actually didn't meet a Black doula until I was in graduate school.
Mm.
And so when I finally met one, I was like, oh, I didn't even think that this could be a job for me. I didn't think this was an opportunity for me in my community. I just assumed that this was not available. And so we had to figure out other ways.
I love you sharing that. And for full disclosure to our listeners, I've actually known
Yes.
you since you were very little.
Yes.
And I was there literally at your house the day your youngest sister was born, but was
Mhm.
someone who babysat and your parents were mentors to
Yes.
me and I saw firsthand. And I think it's so interesting to hear you say, because I can remember you as a child doing the things you described, but even more
Yes.
importantly, as the oldest, how you tuned in
Mhm.
to your mom and her needs. And I
Mhm.
can think back to what she was navigating postpartum in
Mhm.
between children, navigating
Mhm.
raising 4 children and a
Yeah.
marriage and a life and a family and all of these things. And I think too often women in particular, and in particular Black women and women of color, and where culture and
Mhm.
identity collide with some of the norms that are thrown and thrusted onto us, and what we need from a physical and spiritual and trauma informed
Mhm.
level. I know so much of your work really has been a blend of the social work, trauma informed care,
Yeah.
and doula work. I'm curious, what did that background with social work add to
Mhm.
how you approach the work that you're doing now?
I often describe social work and doula work as being so beautifully intertwined because they are both careers where you should have a perspective of equity and justice and where you are a resource hub for other people. And I think it's really beautiful and God ordained it that I would become a doula and a social worker at the same time. I always describe it as like I found my tribe finally. I'd spent, 2.5 decades or so trying to be a champion for change and for justice and human rights and for women's rights. And I found bits and pieces of that throughout my journey. I worked in intimate partner violence, and I really found that as an impactful time, shifting my career and understanding what it looks like to support the family as they're
Mhm.
navigating what often society would say is like cast them out and be done with those people. I
Right.
also found it as a interesting experience. I studied trauma studies from the perspective of femicide or the killing of women because they're women, and
Mhm.
understanding how a community can either come alongside those who are impacted by violence and perpetuating that violence to shift the dynamic and protect those who are victims, or to further the harms that are caused and to create more of a chasm, especially between men and women in a binary in that regard. So I say all that to say that as a social worker and as a doula, I came with those perspectives and knowing that I was searching for something. I was looking for how do I make sure that we're supporting the birthing person and their baby? What role does their partner, if they have one, play into that? What role does their broader community play into that? And how are we also thinking about the systems at play that are impacting people and that are causing the Black maternal mortality rates that are causing the Native American and Asian American mortality rates. What are we doing when it comes to a system that is inherently racist in how it treats people who are not white? How are
Mhm.
we holding that system accountable and creating changes so that we can stop the 84% of preventable maternal deaths in postpartum? Like, what are we actually doing about that? And so when I became a doula, it was the spring of my first year of graduate school, and I felt like this is exactly what I've been looking for. Like, these are the questions I've been asking about women's bodies, how to navigate the hospital systems, how do we make sure that we are sort of connecting people to the appropriate resources and walking alongside them in a way that empowers them, not in a way that says, okay, you go do this thing and we'll be done, but really, how do I see you as a human being and how do I make sure that your specific personalized needs are met so that you have the best outcomes possible? And I feel like that's also what social work is supposed to do is that we're supposed to come alongside someone and say, I see you, I hear you, I respect you, and I honor you. What can we do together to make sure that you get to the place in your life that you feel would be best for you? And so my social work perspectives were shaped by my work in prison reform and also by my work as a bilingual school social worker to help me also recognize that the systems at play needed to be addressed and how can I as a macro social worker make sure that the broader policies and research that's being completed are as honoring as a clinician's one-on-one conversation with someone.
So many rich anecdotes and examples there. And I think people underestimate. I mean, anytime you walk into a hospital, it's incredibly
Mm.
vulnerable, right?
Yes.
And in particular, birthing, like bringing another human into the world,
Yeah.
people really underestimate. I have a friend who is a nurse practitioner and a midwife and delivers
Mhm.
babies for a living. And she always says it's the everyday, most traumatic thing that someone can do with their
Yes.
body that we just are like, it's a miracle.
Just to have a
Literally,
baby.
literally is a miracle. And I think about, for listeners who maybe don't have birthing experiences and maybe don't have
Mhm.
a lot of experiences with hospitals. For me, I spent a lot of time caregiving with my mom's
Mhm.
needs, fighting MS before she passed. And she was always like, you cannot be in a hospital without an advocate for you, someone that's there to
Yes.
support you and look out for you. And I know within my own family dynamic and being a part of a multiracial family and the
Mhm.
inequities that are experienced, we talk a lot about this, whether it's out on the street or in a hospital where we are. I'm the white
Mhm.
representative in my family. There is a level of accountability because there's a level of privilege that is just
It's
bestowed by
given.
my share package that we walk in. But coming in and what they experience and what they need. And the bias isn't always about race. Like with my mom,
Mhm.
fighting MS, the weight that she had and things like
Mm.
that, and she had nerve damage in one leg, and I always think about
Mm.
they would cast off and they'd take the blood pressure on her leg instead of her arm because it was too much work, and then they'd put it on the leg that had nerve damage, and then they wouldn't listen to her. And that's just one example amongst many that I'm sure you could give in the birthing space, and
Mhm.
obviously we wanna keep this conversation around birthing, but I think for the listeners as contextualizing, there are
Yes.
so many risks around getting access to equitable care based on
Mhm.
how you look, your ethnic background, your ability to pay, your resources,
Mhm.
so many things. And then doing that in a time which is meant to be joyful, but it's not without its risk.
Mhm.
I know with the Sweet Bee services, you talk about how everyone deserves a doula. And
Mhm.
I'm thinking about, there are barriers of cost and access, trust, language, culture. And I'm so excited to see the way you give back. And so I wondered if you could talk a
Mhm.
little bit about that and how you resource families who might not be
Mhm.
able to otherwise have access to a doula.
Absolutely. I think though something I'll connect it, but I think
Yeah.
also what you mentioned about your mom and having to navigate the hospital system and having an advocate is so important because I think we often, whether we are able bodied or not, whether we are whatever racial ethnic background, like we live in our own circles and communities. And I think we take for granted that although there might be an institution that is a part of our broader community, it's not something we interact with all the time. I can go into the post office and I have an idea of how it should work, but I don't know what the postal workers have going on in the background. The same thing is true of the grocery store or of a hospital. And so you come to the hospital with the expectation, like, I'm sick, I should be taken care of, or I need medical attention. But most of us who don't go in and out of hospitals on a regular basis are not aware of one, the weight that the medical staff are under in terms of the policies and procedures and the liability that they're held to and the reasons why they do certain things. And they have their own language and vernacular. And so they use terms back and forth that unless you sit in a hospital with that particular team on a regular basis, you just don't know. And so I say that to say we often take for granted that, like, "Oh, I'll get pregnant and just, go have a baby and then it'll be fine." Most people don't recognize that there are at least 100 decisions that have to be made from the point of conception until the time you, like, have a birth experience, whether or not you go home with that baby. There are a lot of decisions that have to be made that often can disempower somebody because they weren't prepared. And so my reasoning for saying everybody deserves a doula is the same reason your mom said everyone needs an advocate, is that you need somebody who is well versed in that system to walk with you. Otherwise, you're just at the mercy of the system. And that's why we see 50% of people walking away from their birth experience feeling traumatized. And so, like, seeing those statistics, having been in the field for the last decade, I was like, if if somebody needs a doula and I'm the right fit for them, we're going to create a model of care and support. And so at Sweet Bee Services, we became one of the first actually Black women owned doula agencies that was Medicaid approved in the state of Maryland, which meant that the curriculum through which I now train other doulas and that our doula team has been trained in is eligible for approval as a Medicaid provider, and we're able to bill insurance for the services that we offer. It is not at the full rate that we charge, but it does give us some reimbursement relief. And so what we've designed is a 3-to-1 model so that for every 3 families who might pay out of pocket, we have a maternal health equity fund that helps offset the costs of supporting families on Medicaid so that they don't have to pay for their services. And it also includes our childbirth education class, which I teach over a 4-week period, or one of our licensed instructors can teach, to make sure that people have that support and that preparation to be able to navigate the hospital system, to make sure they know what decisions they might have to make, and to create a blueprint for, I call it the playbook because I grew up around sports, but to
Yes.
have your playbook of, okay, we're going to try ABC. And if we have to get down to D, then we will. But we know that we could really use these pieces, or we can call an audible and we'll be able to pull in this person or that support, that intervention. But really making sure that people, going back to being a social worker, is I want people to have resources and I want people to be empowered. And everyone already has that power, but we have to be given the keys to unlock that and tap into it. And that's really what our job is as a doula or an advocate, is to say, hey, I'm your coach. I see these things that you may not realize. How can I help you get to that point? And how can I help you realize the greatest expression and experience of this beautifully transformative and intimate and vulnerable process? I want it to be great for you. I don't want it to be traumatic. So here's what we can do.
Yeah. I mean, I don't think people realize that 50% of people walk away from the hospital feeling like it was a traumatic experience, even if they did
Yes.
go home with a healthy baby or babies.
Yes.
That is like 1 in 2. That literally is one of us, one of the 2 of us.
Yes.
That's the experience. And I think that is one, just important for people to know, to better understand. First
Mhm.
and foremost, that really struck me. And then I'm just thinking about how that knowledge probably built through your social work and your justice work to
Mhm.
think about a framework, like you said, or a playbook
Yes.
that you could put into play to really get at giving access now. You're literally
Yes.
building equity within the framework of how your business
Mhm.
works. And that's so
Mhm.
powerful for the families that you help and the
Thank
people
you.
that you help. I'm curious, as you're doing this and building both the framework and how you're resourcing families, what have you learned about building trust across cultures and identities and differences? This
Mhm.
show is really grounded in 3 things, which is emotional intelligence, cultural intelligence, and nervous system regulation, and
Mhm.
helping build those skills. And so when I think about that cross-cultural experience in this delicate time in someone's life, what have you
Mhm.
learned there?
So much. I think I love the 3 core premises of adaptive humans because that is how you connect on an interpersonal level. And I think even as I reflect on having high emotional intelligence is so necessary as a human being, to be very honest. But in my career in particular, I'm constantly reading body language. I'm constantly assessing, how am I showing up? How are the other people in this space potentially perceiving, interacting with what's going on. And so I often tell people, like, yeah, a doula might stand in the room quietly, but we're working. We're not asleep. Like, my mouth might be closed, but my eyes and my brain are constantly working to assess health concerns for the birthing person and the baby. How's their partner? Are they feeling included? How are the nurse practitioners? What about the doctor? Who's this other person? Okay, that's a student. Do they need to be in this space? How are they feeling? And so all of that is just in the hospital. And then we're there for, like, 30 hours. So we're doing that for potentially 2 to 3 shifts of the hospital staff. And that's just one aspect of our work. So I say that to say the emotional intelligence is very important. But I think also the cultural intelligence is so necessary because although 98% of my clients are high earning, high performing Black women, that also has varied cultures within it. And so I have
Mhm.
communities that come from an immigrant background. I have, which is could be African immigrant, it could be Caribbean immigrant, it could be, I've had clients that have partners from Asia and throughout, like literally throughout the world. And so what does it look like to have cultural humility in those regards? And coming from my own cultural pride, like I come from an African American family. We're also Afro Latina and from the Caribbean. And so I bring bits and pieces of that into the work that I do. But that's not the only way to do it. And so I want to make sure that the way that I like to do this work matches with what my clients are actually looking for. Also thinking about culture, we work with grandparents often. And so what is the dynamic between the birthing person and their parents or their parents-in-law and their partner, and like what are some of the intergenerational things that we need to be keeping in mind. And then also I've worked from New York to Florida and as far west as Tennessee and Texas. And so geographically there
Mm,
are different cultures. It's
mhm.
about what foods people may or may not want to eat, or what resources are in their community. Working in New York, I was hailing taxis at 2 in the morning to go between the boroughs. But when I was in Florida, we need to get a car so we could drive to the different places because people want to show the kid off or the baby off to their family members. Like having those nuances of culture for me is so rewarding because I love it. Like I will travel and eat anyone's food and learn about their culture until the day I die. But it's
Same.
also, I think, something I was like that we have a lot of that
Yeah,
in
that's like
common.
very much in common.
Um, yes, I'll never forget the time, this is an ADHD tangent, when we went to dim sum and it changed my
Mm,
life. I was like, "Oh my gosh, I need to find this again." And so I've been on a quest ever since.
I
But
love it.
thank you for introducing me to proper dim sum.
Yes. Yes, yes.
Yes, but in that same light, it's like that is a part of how I show up in the work. It's not how everybody does. And so I think it goes back to everybody deserves a doula, but you need the doula that's for you. And so
Mhm,
knowing how to ask the right questions, understanding their scope of work, and then also understanding them as a person so that the doula and the family have a symbiotic and reciprocal relationship so
mhm.
that it's not recreating a power dynamic that people might have with their medical providers, but really establishing that interpersonal connection and relationship. Because if they don't trust you, if my clients don't trust me, how are they going to advocate in that space? How are they going to be open and honest and vulnerable in conversation? And if I can't remove some of like the very clinical social work of I'm your provider and you stay over there, I stay over here, I had to break down those boxes and really build a bridge of saying, yeah, you can learn about me and my family. You can learn about my dog. You can learn about where I grew up and what my personal ethos is outside of just the very sort of like whitewashed way of doing clinical work. Because I used to be like, I never want to be a clinician. But a lot of what I do comes from clinical social work principles. It's just been adapted to the culture of one of what I think is necessary for building rapport and relationships, but also what I know my clients have asked for. And they're like, I want to know about you because then I can trust you. And then I know that when you're reading my body language, it's not coming from a place that is dismissive, but it's a place that dignifies me and that honors what I'm really trying to communicate.
I know you often describe this as this idea of whole body, whole family care. And
Mhm,
I think about all the corporate work I've done in professional services and basically helping businesses really
mhm.
humanize the workplace, which is we're a
Yes.
whole person. We
Yeah.
don't leave who we are at the door, despite how professionalism has been framed,
Mhm,
right? And every organization has its own sense of rules and norms, and that's
mhm.
okay. It is a business. We're
Yes.
here for a business. But at the same time, the people are bringing all of these different things. And the more we have sort of made this majority focused, and historically in
Mhm,
businesses, it was heavily
mhm,
white, heavily male, heavily cisgendered, Anglo Saxon. You could go all the way down, able bodied. And it was through that
mhm,
lens where just missing the nuances of what people might need. And when you're thinking about getting performance out of people in a corporate or
mhm.
business setting, it's the same in an instance in a hospital setting. You're from everything you've described, and when I know about the birthing process, it's managing everyone, the birthing parent,
Mhm.
the parents, the people, the family members, but also
Yeah.
navigating the systems and the humans that are doing a job
Yes.
who are trying to stay objective and impartial because
Mhm.
they've got to be ready to react if anything goes wrong. And that's no small feat, right? And so,
No.
but every single one of them is bringing an aspect of who they are and their culture
Mhm.
and their identity and their lived experience and those regional norms of
Mhm.
how we do things in the US and around the world. And I think like we miss such an opportunity. And what I hear you saying that you bring to the table is sharing a little bit more by modeling who you are and adapting
Mhm.
and flexing, because I think that's the other thing is that people need to know that they're safe with you. I would
Yes.
imagine that's a core thing, right? And I think about being a diversity, equity, and inclusion professional inside of an organization. There's a presumed by title, like a doula,
Mm.
that we should be safe. But as a
Yeah.
human, it is the earnest is on us as the professional
Mhm.
to ensure that the person who is with us knows that we are safe as well. And whatever
Mhm.
they know about us to be true, and especially I think about me as a white woman doing this, is
Mhm.
across so many different communities, it was the greatest compliment I've ever had by people inside of an organization is Jamie's here for us. And having people
Mhm.
from different backgrounds, walks of life, everyone's saying that same thing. No, Jamie's here
Mhm.
for us. Jamie's here for me. And whoever that me is, because I've always said my responsibility is I want every employee to be able to look at an organization and say, this organization was made for me and designed with me in
Mhm.
mind. And if we can't say that for
Wow.
every person that walks through the door to work there, then we haven't gotten there yet and we've got to keep doing the
Mhm.
work. And so I think in a way, like while you want to have a match that works for a doula, but in that instance, you're playing that role that is making someone feel safe that like you're here for
Mhm.
me and with you've designed this process and you're thinking of everything that is needed with me in mind. And
Mhm.
there's a
Yes.
definite connection in that work in that way of really being of service to people and the
Mhm.
vulnerability that you have to also display to allow safety to
Yes.
occur.
Yeah.
Yeah.
That's so very true. And I love what you said about there is a presumed safety, but
Mhm.
it has to be and that person has to truly feel safe. And I think that is like if there was a way to communicate to other medical professionals or just people in general is that I believe everybody inherently should feel safe. I recognize that is not often the case. And I wish more people would take a chance to humbly ask, do they really feel safe with me? And not to assume that because they have a title or because they have some level of achievement that people would feel safe. And I recognize sometimes that's not a priority for other people. But when it comes to vulnerable experiences like having a baby, like being in a hospital space, navigating big transitions in your life. I think of even like if someone's buying a home or if somebody is moving, to a new community, you want to feel safe. And it's
Mhm.
not it's a right to feel safe.
Yeah, absolutely.
Mhm,
Well, that leads us into the brave enough moment. And this is the segment
mhm,
where we take that first imperfect step, giving examples of what that looks like when maybe all of the ducks weren't in a row. You didn't have everything perfectly finessed, but you knew that that next step was that brave enough moment that was going to lead to what comes next. And I'm curious if you
mhm.
could tell us about a decision that required courage to take a leap. What was a brave enough moment for you?
Hmm. I think back over my career and I'm like, I think there are several
I'm sure.
of those
Yeah.
brave enough moments. The one that sticks out the most is when I decided to become a full-time doula. And I think that's really important because I was only about 5 years into my doula career. And for those first 5 years, of course, the first year I was finishing my master's of science and social work at Columbia University. And then I moved back to Baltimore, which is my home. And began a job essentially in leadership for a nonprofit and worked there for the next 4 years, working my way up to director of operations and chief of staff. And so I had a full time career in leadership and management. And on the nights and weekends, I'd be going to clients' homes to support them with their birth experience or telling my team. Thankfully, I led a team of mostly moms. And so they had to have flexible hours to be with their children. And I was like, well, I need flexible hours to help these other people have babies. So we worked it out. But I remember in January 2020, I just come off of leave, medical leave for burning out in my job because I was doing too much and then trying to figure out how to navigate all the things. And ironically, I hadn't burned out from being a doula. I just hadn't had the capacity to doula in that season because work had been so demanding. And I remember feeling like if I can't do this, then I am not in my calling as a human being. Like I need to be a doula for people. Like this is what I was born to do. And so I approached my boss, honestly, right before the pandemic hit, so February of 2020, and said, hey, I'd really like to be able to work virtually because I need to have more flexibility to be a doula. And if we need to reduce my hours or something, let me know. But I need to figure out a way to do this. About a month later, the entire world shut down and we
Right.
had to work virtually. And I was like, this is what I was taught. Not with the death, that was terrible.
Yeah. Right.
But in terms of like the flexibility of everybody being virtual. I said I knew there was a way that this world could work virtually. I just didn't know how to get to it.
Yeah.
Um, but that year, I actually served 27 clients because the need for doula care, which is, mind you, that's like my record at the time was 27 clients over 4 years. So to serve 27 families in 1 year was a lot of clients. And the need was so great because people were not able to get the care that they needed from their providers and or go into hospitals. And so there were a lot more home birth requests. And there was just also a different level of need in terms of how do we navigate hospitals when my baby might be taken to the nursery or navigating COVID. And because I come from like a health nerd background, I did a lot more research and was staying on top of like World Health Organization protocols. And so people were reaching out asking me, how can I do this given what's going on in the world? And so I was really honored to support all those families, but it felt like confirmation from God of like, this is what you need to be doing and you need to prepare to do this full time. And so the following fall, September 2021, I left my job as a director of operations and chief of staff and opened an agency. And it was very much so like, well, nobody, when I became a doula, no one in my circles had ever heard of one. They're like, what are you going to do? You just got all these degrees. Like, I have 2 bachelor's degrees from Howard University. I have this whole master's from an Ivy League, and you're going to wipe people's bodily fluid and catch their baby. I was like, well, I don't catch the baby. So what do you do? I was like, I'm there. I'm present. I'm emotionally available. I teach them. But it was a foreign concept to my family, and everyone was sort of scratching their heads. And so in 2021, well, they're like, the world is ending and you're going to leave your job. Like, you have a job. Other people don't have a job. You're going to go into this very insecure world of entrepreneurship and do what? And I was like, I'm going to start an agency. And I'm just going to trust that God said I should do this and the people will come. And so that was a very brave moment. That was
Mhm.
4.5, almost 5 years ago. And we now have a team. We had grown in scale so quickly. We had a team of about 16. And I was like, I don't think this is the best fit. So we've actually scaled down to a really strong but lean team of about 6 to 7 doulas. We also have a Medicaid apprenticeship program. And so now we teach new doulas. I mentor them. They can support families who might be receiving public insurance, and then they can scale into our concierge training program so that it can support families with more time and greater depth in their care. But in terms of a brave moment, I was very scared when I made that decision and I
Mhm.
didn't really know what it would look like. I just knew that I needed to do it. And I think that has been sort of like the thread of my entire career is that I'm a person who moves off of instinct. And so when I feel like that's the direction I should move in, most times it's not very clear, but the clarity comes as I take the steps and continue along the path.
People underestimate that the full clarity doesn't usually come before you take the first step. That brave enough
Yes.
moment is the action that the clarity comes after. And I just had a guest on recently that literally was talking through that
Mhm.
living your all is really the clarity comes after.
Mm.
You actually named so many brave enough moments, even buried like kind of the subtext within that.
Mm.
And one I just want to call out because when we think about the caregiving that is required, and you talked about the emotional intelligence and cultural intelligence, but also nervous system regulation, you
Yes.
being willing to say that I need to take a leave to help myself
Mhm.
with this burnout. There are
Yeah.
so many people that, and women in particular, that push
Mhm.
through and don't allow
Mhm.
that. And so as you were telling the story, I was thinking, wow, how powerful that you couldn't even have known in that moment, but that brave enough moment
Mhm.
to allow yourself that time to heal and
Mhm.
rejuvenate pivoted you into this thing that was going to like 27 births in 1 year,
Yes.
a new business, a pandemic,
Yeah.
like so many things, managing
Mhm.
still the job that you did have.
Mhm.
You don't always know that's around the corner. The brave
Yeah.
enough moment isn't just the things that are the outward accomplishments, but they're also the
Mhm.
inward things that we need to serve ourselves
Yes.
so that we can be in service of others. I know it's taken me
Mhm.
a very long time to learn to put my own oxygen mask on first, and I still
Yes.
have to be reminded of that on a regular basis. So I just wanted to throw that out there because I think it's such a great example for people who might be listening and thinking people are navigating that and unsure of what to
Mhm.
do. And if you are in a job or a position that like that resource is actually there through FMLA, being able to make that happen is so important. The other
Mhm.
thing I just wanted to point out that I heard you say was just, I think how you've been able to, you scaled bigger, you scaled back, you found what actually works for you and the
Mhm.
business model instead of just doing and growing and doing and growing, which allows the quality, but you're still through your mentorship program and the training, you're really able
Mhm.
to give back on that. And I'm wondering, are there ways that you're measuring that impact or scaling that
Mhm.
in new ways? I know you have an app, so I'm just curious, like how
Mhm.
has that grown into things that are helping more doulas and helping more families?
Absolutely. So, I think a lot of it has grown organically. My first student, I'll never forget, my very first student, I'm one of the founding members of the National Black Doula Association, which is headquartered in Atlanta, Georgia. And it began in I want to say 2017, 2018. Or like it started formation 2017, but it really started accepting founding members in 2018. And so that's when I joined. And in 20, I want to say 2019, 2020, I began teaching. And so I was teaching other doulas how to be a birth doula, how to be a postpartum doula. I also was constantly taking classes. I was becoming a certified lactation consultant. I also am a certified childbirth educator. I'm a certified placental stem cell consultant. And so I just was always like looking for more knowledge. And in that, I was like, nobody has talked about this. We need to tell other people. And so I think that's the big sister in me too. It's like, hey guys, let me tell you this thing. And so I would get in Facebook groups and ask if people wanted to join. I started meeting more people, especially who had heard about the Black maternal mortality statistics and wanted to get involved. And I said, come take a class. Like, I will train you on how to be a doula. But that training morphed into me developing a curriculum because there were so many gaps that I had seen from my own trainings of, okay, well, nobody's talking about NICU. No one's talking about bereavement. Who's training on how to care for people if they've experienced a miscarriage or a loss? Who is talking about the trauma that occurs if you are, I don't know, if you have experienced a loss and now you're having a baby, a rainbow baby, but you're seeing blood. What does that mean? How do we navigate relationships with partners? And I didn't have a mentor in that process. I had to go figure it out. And so I said, I really would love to do something or create something where the people coming behind me in experience don't have to start from where I used to be, but they could really start from where I am. And I recognize that for some people that could be overwhelming and for some it's like, well, that's like too much to do. I was like, no, I don't think it is because our clients deserve us to be at our very best. And why cause havoc and be contentious of like, well, I went through it, so you should go through it. I had never understood that mindset. I feel like it's very petty. And I'm like, if you know it, share it. It's like it's group economics. And so I wanted to create a mentorship program that did that, that helped people understand what do you do after your training? How do you get to seeing a client very quickly? Because people always want to know, well, how do I find clients and how do I apply all of this? And so I built out my own training program and my own mentorship program so that students can spend 6 weeks training with me. And from that 6 weeks, they go into 6 weeks of mentorship, but they should be able to get a client within 2 to 4 weeks of that mentorship program and have one on one support and group support to navigate those experiences. What do I do if? How do I do this piece? How do I have a contract? And as being a doula has become much more accepted as a healthcare profession, there have been a lot of changes in terms of how are you remaining HIPAA compliant? How are you using AI and telehealth? Like we were doing telehealth in 2019, 2018 before anyone needed it. And so when the pandemic came, I already had a system in place, but now it was available for more people. And so how do we tweak that, keep it compliant, make sure people have access to it? How are we marketing? All of those things are included in the training. Because I want to make sure that even if somebody doesn't get Leah as their doula, I have limited capacity. So I can only take but so many
Mhm.
clients, but I don't want the quality of their care to be any different or any lesser than. And so I have created lots of mini me's, and I'm really honored that most of my students have become mentees. And then my mentees have actually joined the team and are some of our longest standing members on the team because they get the model. And even a client recently, I was working with my one client for the year and said, okay, it's time to switch to one of our team members. And she's like, but they're not you. I said, they're not me, but they've been handpicked by me and trained by me. So let's meet them and see how you feel. And so she said very clearly for one of them, she said, I can tell she has your vision and your process. And that to me was like one of the highest
Mhm.
compliments because it meant that
Mhm.
I had imparted in her what she needed for her to do her own style and her own variation of it. but that there was consistency and that it was clear and that my client felt the same level of care, the same depth of experience and knowledge, even with somebody who wasn't me. And so that is the Sweet Bee Doula training process. It's a 12-week process, but we're also expanding to have a monthly sort of like ongoing touch point so that people can have the sustained connection and build out their network appropriately so that they have that support as they are navigating the doula world. And to that regard, I did build an app. I built an app called the Sweet Bee Health app because I was seeing a trend where folks who are navigating postpartum depression, looking retrospectively, had also navigated preeclampsia, but I didn't find any research that was connecting the two. And preeclampsia is a blood pressure concern that happens during pregnancy. It is connected to the health of the placenta, but we don't know fully if people will get it with every pregnancy, what always contributes to it. We're learning more that sperm health contributes to placental health, and that contributes to preeclampsia
Mm.
dispositions, but it's still very unknown. And so a lot of times when somebody is diagnosed with preeclampsia, it can be late in their pregnancy. And so they get rushed in for an emergency C-section or an induction, which then puts them on a number of medications, one of them being magnesium. And it's such high levels of magnesium that they're considered a fall risk. So they have to stay in the bed and stay on that medication, sometimes 12 to 24 hours after they've even delivered the baby. And I've found that a lot of times if people have, I call it like a snowball effect, but if they have the snowball effect of interventions, the likelihood of them having difficulty bonding with their baby increases, and that can lead to difficulties in postpartum, including the likelihood of developing postpartum depression. This was
Mm.
from observation with families with my career since 2016, but I did not see a single article connecting the two. And so I said, well, what if we build an app that helps people, one, be empowered to track their health so they could figure out if they might get preeclampsia much earlier? Because a lot of people don't know how to take their blood pressure. So I was like, well, we can
Mm.
teach you how to take your blood pressure. You can track if you have some of the risk factors of developing preeclampsia or postpartum depression. And you can take this data to your provider and say, hey, my blood pressure has been off for the last, 12 readings. When I come to the office, it's one thing. When I'm at home, it's different. I need some support. And they could have that conversation at 24, 25, 26 weeks in their pregnancy, as opposed to coming to their 38-week appointment and the doctor's like, oh, I don't like that reading, go for observation. And now all of a sudden they feel like they've been bamboozled into having their baby when they weren't ready, or when they just weren't prepared for what that conversation was going to mean. So I wanted to find a way to really, one, empower people, but two, to make sure that other doulas had a tool that they could use to say, hey, my client should be using this. If you use this, you can track it so that even if a doula doesn't have a healthcare background necessarily, a lot of times people are educators or they work in social services. And so they don't necessarily have all of the same sort of medical tools that if somebody's a nurse or comes from another clinical background that they would have. So, how do we give them a tangible way to support their clients and advocate for their needs? And how do we also figure out, is this truly a connection? Is there something that we should be doing from a research perspective that can formalize resources that would help to prevent this for people? And so I kind of go back and forth between my researcher, my doula, my social work hats, but I saw a problem and I wanted to create a solution and I want to iterate until we find something that's tangible and practical for people.
Wow, that's fantastic. I'm
Thank you.
excited to see as time passes and there's more usage of the app
Mhm.
just because I know you're science leaning, research
Yes.
minded, like the data that you'll be able to collect from that that hopefully can
Mhm.
influence how people are treated around preeclampsia and earlier
Mhm.
diagnosis and the ties to normalizing understanding risk factors and treatments and
Mhm.
support for potentially postpartum depression that occurs. That's really fantastic. Before we
Thank
move
you.
to our next segment, my last question I wanted to ask here is if you were able to have this conversation, say with a hospital or
Yeah.
an employer, when you think about one change that could move towards more equity that kind of
Mhm.
would domino some of the other things. If they said, "Hey, Leo, we just want to get your input here, and there's a magic wand that we could implement," what
Mhm.
would you say?
Every birthing person should have a doula by their side, whether they're having a C-section or a vaginal birth, and there should not be any sort of bureaucratic rub to get that person into the hospital and by that birthing person's side. Should be that like there's a list of approved doulas, you show your badge, you just walk straight in. I would say from an employer standpoint, and I recognize as an employer it can be expensive, but we need to provide, and this is like a government advocacy thing as well, but we need to give people 12 months of leave that is connected to pregnancy and postpartum. Ideally, it'd be 18 months. So you could take care of yourself during pregnancy and also for at least that first year of postpartum. But hormonally speaking, biologically speaking, people who have given birth need at least 12 to 24 months before their body is back to a state of homeostasis where their organs are in place, their hormones are more regulated, their brain is back at a decent place because they have been able to sleep more consistently. It takes a long time. And so if we could create systems where people are not worried about whether or not their job will be waiting for them or whether or not they're going to have financial stability, housing stability, that would be ideal.
Those are great additions. We'll keep the recording. Hopefully, people are listening and can do that power. The first one seems very simple and straightforward, and there's procedures you can put
Mhm,
in place to vet people. Doesn't seem that difficult,
mhm.
but thank you
No.
for that.
Yeah.
As we turn to the Just Be Reset, this is the segment
Mhm,
where we think about what are some helpful ways to help us regulate and reset. And I
mhm,
talked about the analogy of like put your own oxygen mask on first before helping others. There's so much about what you do that is in service and has to be so in tune to others and the
mhm,
challenges of dysregulation that's occurring around you and staying grounded and regulated yourself. I'm
mhm,
curious, how do you help put your mask on first? Is there a boundary or a rhythm that you use that helps
mhm.
protect your nervous system and supports you as you're supporting others?
Absolutely. I, for one, do not take clients during the holidays. I have found that I need to have time in my schedule that is for me and time in my schedule that's for my family and loved ones. And so my whole team knows I go on sabbatical in August. It's my birthday month. It's the month where I have chosen that I don't work during that month if I can help it because I need to rest. I need to be able to see loved ones. I need to, deep clean my house if I want to. But that's one of those things is like just having a time boundary. There's a cadence so that in the year I typically have like a heavy push in the fall, heavy push in the spring. We're a little more reflective in the winter. And then we enjoy the sun in the summer. I think that also ties to my like weekly routines. Typically I make sure that I can end my work day in terms of interacting with other people. If I can't end it early, then I'm going to start it later so that I have space for my morning routine. I have a dog named T'Challa. He is a sweetheart. And so first thing in the morning, he's like, what are we doing? I'm like, you know what we're doing. I'm going to get my coffee, going to sit in my chair. I'm going to journal and read my Bible. And then I can get up and like walk him, start to interact with other people. And typically, I try not to have meetings before 10 a.m. so that I have space in the morning for that. And then I think it also comes down to not taking 27 clients a year. That is not a
Right.
feasible number.
Right. Right.
It
Right.
was a global pandemic and there was a need, and I'm really honored that I was able to meet that need. But it also means that if I'm with 27 clients, and at that time I was spending an average of 90 hours per client. So the amount of time and energy that I was investing into my clients meant that I, wasn't able to invest that in my personal relationships and or in my personal well-being. And so I had to really reestablish what does it look like for me to fill my cup so much so that it's overflowing and that I can give from the saucer that's supporting my cup. And I teach that to my students all the time of like I like to do very intentional check-ins because now it's not just me that's pouring into clients, but I need to pour into my team so that my team can also pour into our clients and pour into my students and different projects and partnerships that we have. And so being very mindful of my emotional energy and how I'm physically taking care of my body, which feel like very fundamental foundational pieces. But I remind myself that I need to doula myself the same way I tell my clients to mother and care for themselves. And
Mm.
so I need to be intentional in those regards as well. And then I think when it comes back to like nervous system regulation, a lot of it, like we use a lot of mindfulness and breathing. And I find that I do that consistently throughout the day, especially at my high meeting times, like, okay, deep breaths. It's gonna be okay. We're gonna
Yeah.
move through it. But also thinking through what does it mean to move my body, to give my mind a break, and to be mindful of the fact that I need a after being with clients because especially if I've been in the hospital space, I need a day or 2 to re-regulate my system, to go to sleep, to help any aches from standing for 30 hours, and then I can go into postpartum care.
Thank you. Those are such great nuggets, I think, to help people. I also love the idea of the saucer underneath the mug. And I think
Yes.
we live in a world sometimes that's less formal these days, and everyone's focused on the mug
Mm.
and how you're filling it and what the process is. And I know you come from a mother who is a brilliant host and party and event
Yes.
planner. So having a formal tea with the saucer, but like giving from the
Yes,
saucer,
exactly.
that's going to be me. Am I giving from the saucer or giving from the cup? Like we're always focused on what's in the cup and not what's lifting
Yes.
the cup.
And if
So
you
that's
focus on what's in the cup, like, people are gonna pull as much as you're pouring in, and it's never gonna be full. But if it's overflowing, then you're good and they're good. And they don't know it's
yeah.
from the saucer. They just know
Yeah.
it's great. They just know that Jamie is attuned to me and I feel cared for and safe. And you can also feel that yourself from what you give to yourself.
Hmm. That's amazing. I'm going
Yes.
to keep that one up there. I'd love to do a quick lightning round, if you will, as we wrap up
Mhm.
with some questions. So the first one is a birth book. What do you love giving to clients as a potential book as they're preparing for birth?
I have a affirmations coloring book for new moms and new dads, and it is meant to be inclusive in the representation, but it has affirmations that I created for clients, and the one for dads has affirmations that one of our dads created for dads.
Oh, that's amazing.
Thank
Um,
you.
I know it's supposed to be rapid fire, but so
I
impressed
know, I
with
was
you
like, "That's not as
today.
fast," but I'm sorry.
No, 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 no. It's totally fine. What is one myth that you would retire today? It can be as a founder, a leader, or a doula. One myth you'd retire today.
Everything that is instinctual is not easy.
Ooh, that could be a whole episode, Leah. Okay, I like that. Best question a patient can ask a provider is.
Are these all my options?
Mm, like it. A mantra to live by that helps you stay grounded.
My path is beautiful and crooked and just as it should be.
Say that one more time.
My path is beautiful and crooked and just as it should be.
I am believing that that is going to be in service of somebody that hears that today, but I
Well,
love that for you.
thank
Leah,
you.
I just cannot thank you enough for being here on the show. And even more importantly, the deep, deep work that you're doing, both to eradicate maternal mortality and bringing equity to Black women and all birthing parents in this world is so incredibly powerful. I'm excited for the app and the research and all that you're continuing to do. Every birthing parent deserves the right to a safe birthing scenario where their needs are fully met and the depth of care is trauma informed and culturally informed. And I know that you and your team at Sweet Bee Services are helping bring that model of care to the world. And so I'm so excited. And just know, as listeners, we'll be linking more resources to you and your work and what you all are doing in the show notes. But Leah, thank you again for being here.
Thank you so much, Jamie. Thank you for having me. And thank you for being both a mentor from afar and nearby in this work. I appreciate you.
My honor. It's my honor, Leah. Thanks again. What an incredibly impactful episode today. I really think that Leah gave us so many nuggets to take away. And I'm so grateful to get to have this conversation and really highlight the impact of the work that she's doing and the research and new app and so many things that I know is going to bring an impact to our world. What I hope you're hearing is the braid of the wholeness that Leah names throughout the episode, where emotional intelligence is to feel and name what's true in the room, and that cultural intelligence is to honor culture and identity and see people with humility and with care, and nervous system tools to stay steady enough to choose advocacy over reactivity. If today's episode brought up some strong feelings for you, be gentle with yourself. Take a breath, reach out to someone you trust. And if you're in the US and you feel like you're in crisis, dial or text 988 anytime for support. If this episode was a companion for you, share it with someone who's preparing to welcome a child or maybe a professional or leader that you know in your organization that can shift a policy to make resources more accessible in healthcare coverage. We linked the information about Leah and Sweet Bee services in the show notes. Adaptability starts with presence. There's a lot in our world that pulls at us. Take a breath and reset. Keep practicing connection with yourself and the people who help you take good care. Until next time, remember, I am brave, I am enough, I am brave enough, and so are you. This is Adaptive Humans, real talk, intentional growth.